Hi, my name is Kevin and I am here to do a demo video on IV skills. So that will be setting up an IV push med, setting up a primary and then doing a secondary piggyback. So now we're going to go ahead and we are going to set up and say we're in the medication room right now and I've gathered everything I need and I'm going to first perform some hand hygiene and we have all of the meds here. So the first thing we have is the Zofran, and the Zofran is going to be used to treat any nausea, vomiting, and it is we want to look out for dizziness, constipation, and headache. Contraindications for this one would be severe liver disease and allergies. And safe dosage is every 4 milligrams every 8 hours, and she is going to be getting the 4 milligrams or 2 milliliters. So as I said, we're looking at the expiration dates and for each one, and we're doing the 5 rights for all of them. So that would be right patient, right medication, right dose, right route, and right time. And so now over to the IV fluids. This is going to be used for hydration. What we're going to want to know is assess the site before we administer it and notice that it can provide fluid overload and adverse effects. Again, will be the fluid overload and electrolyte imbalance. And notice the safe dosage for this is going to be 75 to 125. We're going to be giving her 125. And then next we have the ciprofloxacin, the antibiotic to treat her UTI. We're going to want to know that this can cause nausea, vomiting, diarrhea, and headache, dizziness, and photosensitivity. And then we're going to notice for the contraindications that it'll be allergies and something to make for women where and be valid for Irina is that it can also be pregnancy and breastfeeding. Then again, the way for the benefit outweigh the risk here as you administer it. So we're going to go ahead and check the expiration dates. I think we have everything we need. We verified in the MAR. So then we're going to go ahead and go to her room. We're going to go ahead and provide privacy. Hi, my name is Kevin and I'm going to be here. I'm your nurse today. I'm going to give you some medicine here for you. Can you get your name and date of birth? Okay. Checking here. She's going to confirm that she is on your track. All right. Now, before we go, track, is there any allergies that you have? She's then going to confirm to me that she has none. And then I go ahead and we're first going to go, we'll scan her in there, and then okay. Right now we're going to go over the medication you're going to be taking. So this is going to be the Sofran is going to be to help any nausea or vomiting you might have. And next we have an IV here. This is going to be go ahead and give me hydration. And next, then lastly, we're going to have the ciprofloxacin, which is going to be used to treat the UTI. So now we'll go ahead and I will first done more hand hygiene. I'm going to put on some gloves. And we're going to go ahead and again, I'm not sure if I mentioned it, just need to compare the MAR, we're doing the 5 rights of the right medication, right patient, right dose, right route, right time, and expiration dates, of course. And so we're going to go ahead with this here. We're going to go and scrub the medication right here. We'll go ahead and get this set up. And we're going to go ahead now. Let's make sure this doesn't get tight. we'll go ahead and we will draw out 2 of air. And what can we draw a little more? Then we'll go ahead, inject the air, and then we'll go ahead. Okay, let's try this again here. Let's try this again. Fuck, we're gonna have to stop. I'm having the... Okay, so as you can see, we have to go ahead now. We have the right amount of med in there. We'll say for this purpose that I had. Okay, so it's good. And yep. We'll go ahead and cap this. So we're going to go overhead and scrub the port here. No, we're actually checking for any infiltration and inflammation at the site. So we're going to go ahead and we'll do this for about 15 seconds and do 5 seconds air dry. And then we're going to go ahead and do a flush here. And we'll do about half here. Do nice and slow. Notice we would be wanting to get rid of the bubble there. Okay, so that's good. When we put the cap down, then we'll go ahead and we'll do let's wipe this down again, seconds, and then we got the mid here. Oh, let me go ahead, don't want to do that. Okay, so we're going to go ahead and then do this over 2 minutes. Good, again, checking for any inflammation, infiltration got going on. And then we'll go ahead, we'll just say this is a new one. We'll scrub it again. And then we'll go ahead and let's just use the rest of this here, the rest of the 5. Over 2 minutes. Checking for any leaking, trace inflammation. Then we'll say that we've gone and scrubbed again, and then we will cap it. Next, we're going to go ahead and set up the IV. So we'll do a little. And so we have first, and what I forgot, hold on a second. Okay. So we'll go ahead and set this up here. Alright, so let's grab primary tubing. I'm sure this will have this. So we're using this, but this would be new. So then we'll go ahead, take, oh, wow, okay, so that is not what we would want to have happen. So let's actually, so say if that were to happen, what we would have done, because this is reused, what we would have done is we would have done a different technique where we would start it back like this, and then holding it above, not being careful not to touch, we would go like this.
Are you feeling any pain?
Okay, and then here. So of course we'll also be making sure that I have this roller clamp all set here. And then we will go ahead and we've got this all set up. Take the cap off here. And then we've been checking for any air. What we would be doing, we've been checking for any air bubbles. We can maybe let it run a little bit, or we can also raise it up this way to get them out. And so say there are none. Now we're going to go ahead and move over to the patient. We have already, we've uncapped that. Say we'll just for good sake just wipe it down, infiltration, inflammation, leaking. So then we will go ahead, let me just check something here. So we'll go ahead and we will connect. Okay, then we'll go ahead and unclamp it here. That'll be moving. And then now that we've got that done, move over to the secondary. As we can see, this for the ciprofloxacin, this is the calculations we came up with. And now, again, what we will have done with the IV, we've also would have been looking at the flow rate, make sure everything's going well. So then we're going to go ahead and set this up. Well, to avoid having the same issue, because it's going to happen, we are going to do the same technique we did before. Oh, there's someone right there. And that will go ahead. This is going to be the label I'll put down right here, 72 hours. And there's that. Let's make sure there's a good in here. Okay, so I'll make sure not to touch. So go ahead and put this up here. We will go ahead and we have also, if we haven't done it, we'll pretend like this. Also just grab this. 15 seconds, 5 seconds, air dry, and then so we'll check to see. We'll do this for halfway. Then we'll go ahead and we'll check for any air dry and the air bubbles. And now we're going to go ahead and connect. Connect here. Then we'll go ahead and we will open it. And so then we're checking it. If it's going well, observing the flow. We will go ahead. Actually, what we would have done, though, this was an error on my part. We will have gone ahead and hung this. A big error on my part. So then, now that everything is set up, I'm going to ask her if you are, she needs anything, are you in any pain? We're then going to go ahead and lay the lowest bed. And I'll go ahead now. Alright, so much. I'll go and I'll do hand hygiene. And then we're going to go ahead and do a call light there. And then we're going to go ahead and document. Alright, Thank you so much.